Delhi's air pollution is attacking your joints even before symptoms show up. A doctor at the Rheumatology Department at All India Institute of Medical Sciences has thrown new light at the role pollutants play in triggering autoimmune diseases such as rheumatoid arthritis. As AQI reaches hazardous level, rheumatology OPDs across the city see an uptick in patients reporting complications. It can be blamed upon toxic particles interacting with cell linings through the airways. When polluted particles reach the airway lining, they alter the cellular proteins. These transformed proteins are then no longer recognized by the body's immune system. This is what doctors call a breach of tolerance. The immune system launches an attack, triggering an oxidative stress and systematic inflammation. The immune system mistakenly attacks the body's joints, causing inflammation, pain, swelling, and stiffness. A 2025 study published in the European Medical Journal says long-term exposure to PM 2.5 can enhance the risk of developing arthritis by 12 to 18%. And many patients in Delhi NCR feel higher discomfort in the early morning or late evening when temperatures drop sharply. Cold temperatures cause the muscles around the joint to tighten and the tissues to contract. This slows blood flow and increases stiffness, especially in people with osteoarthritis and rheumatoid arthritis. People living in heavily polluted areas tend to heal more slowly after joint surgery and have their joint pains return more often. On this issue, I'm joined by Dr. Vineet Malhotra. Thank you so much, Vineet, for joining me at the last minute. Vineet, people think air pollution, it has to do with lungs. I mean, air pollution to do with joints and arthritis. How does this happen? Can you just break it down for our viewers?
Thank you, Kartikeya, for having me online. And yeah, it's very interesting. When we talk about PM 2.5, we must understand the size of the particulate matter that we're talking about. It's just 2.5 micrometer. And when we're looking at that size, that's extremely, extremely small, much, much, much less smaller than even human hair. And that particulate matter can not only get into the lungs, but also get into the bloodstream. Now, when you get into the bloodstream, you initiate a system response, which means that this is going to be a response which is going to be there in the entire body. And it will affect things like joints, it can affect your kidneys, it can affect the heart, it can affect the respiratory system. So there's no one system that it will spare, and you'll have this systemic illness response or this kind of a systemic illness inflammation throughout the body, and which is why the joints are not spared, and you will have this systemic inflammation in the joints. We know that joints are particularly susceptible. These are the mobile points. They're the points where you have mobility and you have the risk of inflammation, even per se, even without having an inflammatory response. So such a response will affect the joints.
So what is the solution? How do you reduce the inflammation? Yoga? I mean, so not everyone can have air purifiers all the time, So what do you do? Drink a lot of water? I mean, so there are a lot of things which people put it out on Insta, but from a doctor, what should be done?
So yes, particular things. So in the, Delhi in the winters can get fairly bad. And the first suggestion is, if you go out for walk in the mornings, delay your time, because we know that this dust, this soot, this PM matter will be aggravated in the early morning hours. So change the time that you go out for your walk, because you're going to have a risk which is going to be fairly high earlier on in the day. And we've seen this risk actually increases in both children and the elderly. So particularly more in them. And we know with elderly, we're looking at joint issues more commonly. Unfortunately, also with the younger generation now, with the kind of pollution that we're seeing and the PM matters that we're seeing. So one is, yes, change your walk hours. Mask, if you can. It's fairly normal now to be wearing a good quality N95 mask. Make sure that you do that when you go out in particularly poor AQI level environments. The third, yes, fluid helps you.
Fluid helps you. How does the fluid help you?
It'll actually wash out. So fluid is a good substance to actually wash out the inflammatory response material. So this is something that you can actually use to wash out excessive inflammatory material.
Vineet, air pollution has become I would say, new urban nemesis, and now I wouldn't even say urban, it also affects the rural areas. we had done a number of stories in which we were able to inform our viewers that air pollution is not restricted to urban centers. It's evenly spread along. Indo-Gangetic plains are very badly affected. The eastern part and the western part and the Gangetic plains are worst affected because of the climate. Now, in context of the cold and the pollution, do you think that this inflammation is a new problem? Because a lot of new studies show that inflammation can actually impact overall health. Body inflammation of organs should not be taken lightly. It impacts your overall health and longevity.
So when we look at aging of any tissue, it's an inflammatory response. All oxidative responses, which means those that require oxygen for their metabolic activity, are inflammatory responses, and all of these responses will hasten cell death. So what we are looking at is a early aging mechanism wherever inflammation in the body happens.
So, do you think that the diet and the change in lifestyle can help us tackle the inflammation, which something which it's very difficult to avoid, which is bad air?
So we know that there are a lot of natural occurring antioxidants in diet, and there are similarly a lot of pro-oxidants, or those that are going to be pro-inflammatory mediators of oxidation, which are also there in poor diet. So it makes a lot of difference in terms of diet. You've got your fresh veggies, fresh fruits, and if you can stay away from the packaged stuff, if you can stay away from stuff that's going to more likely lead to inflammation, that's something which is definitely beneficial. Similarly, lifestyle. This is another thing. We've seen metabolic syndrome. We call it metabolic syndrome, which is another marker of inflammation. Obesity, poor lifestyle choices, lack of a sedentary lifestyle, smoking, all of these pro-inflammatory mediators. So, if you're already smoking enough from the pollution, why do you need to add more?
So, do you think that taking oxidant supplements help you in this?
Antioxidants.
Antioxidants?
So if you don't have a very rich antioxidant diet, it would always be a good idea to at least have one antioxidant as a supplement in your diet, which then works as an anti-inflammatory agent for your body. These are simple, effective, and they're usually without any adverse effects, so they can be taken very safely.
Very quickly, what is an good antioxidant diet?
So fresh fruits and fresh veggies have good amount of antioxidant diet. But if you are also into something like if you take non-vegetarian diet, then certain fish will have a lot of omega-3 fatty acids, which are very good source of antioxidants. So a variety of things both in the vegetarian diet and in the non-vegetarian diet contain a good amount of antioxidants. So you have nuts, berries, you have fruits, veggies, and you have fish.
Okay.